Hi, my name is Maria. I'm a family nurse practitioner student from the University of Texas in El Paso. Today I will be discussing with you different birth control methods. We'll discuss from the least effective to the most effective birth control method, and then I'll discuss some pros and cons of each method. First is the natural birth control method, or the fertility awareness method. This one basically, you estimate the time that you are most fertile, and during this time you either abstain from having sex or you use a barrier method. There's different methods. I'm just going to discuss two of them. The first one is the calendar method. This one you're supposed to you monitor your periods for 6 months. Then to figure out the days when you're the most fertile, you're going to subtract 18 days from the total length, the total length of your shortest period, and that will be the first day of when you're most fertile. And to figure out the last date, or the final date, is that you subtract 11 days from the total length of your periods, the longest period. So in a typical woman with 28-day period, you would be most fertile between day 10 and day 17. Then we also have the cycle beads, and this one is, you're going to move this little round thing, this ring, to when you first start your period. So during the red one is when you first start your period. Then you move it as you go, as you're having your period. So you just move during these brown ones is when you're the least fertile. During these white ones is when you're the most fertile. And then, so you just keep moving it until you get a period till the next month. And then during these white ones is when you either abstain or you use the barrier method. The pros of this method is that you don't have any hormones, so you don't, and it's private. The cons is that you have to have a partner. You have to have regular periods to do this natural birth control method, and also you have to have a partner that is willing to abstain during these periods. So that's the natural birth control method. Then we have the Plan B, or the emergency contraceptive method, and this is anywhere between 59 and 94% effective. This is a Plan B. It's just one pill that you take as soon as you have unprotected sex. You have up to 3 days to take the pill, but as the furthest you get away from your unprotected sex, it's less effective. It can be bought over the counter. You can take it when you're breastfeeding. The cons of it is that it may cause some stomach upset and nausea, and you might also have your period might come late or early. But if you have not had a period in 3 weeks, you need to get a pregnancy test. And also it's expensive, so that's a con of this method. So that's Plan B. Then we have the diaphragm, which is anywhere between 84 and 94% effectiveness. And it does have to be fitted by a provider, but then after that you take it home and you just put it when you're going to have sex. This method you have to use with spermicide, and spermicide can increase your risk of getting HIV. And it should not be used when you're bleeding or you're having any vaginal infections, and it may increase your risk of getting bladder infections. This is the diaphragm. The next is the spermicide. The spermicide is anywhere between 71 and 85% effective. You insert it every time you have sex. So this is the foam and this is the film. They're available over the counter. The cons of this method is that it might irritate the vagina or your partner's penis. And it also increases your risk of getting HIV, the spermicides. Then we have the female condom. The female condom, this is a female condom, and its effectiveness is anywhere between 79 and 95%. You're going to use a new condom every time you have sex. The pros is that you can buy it over the counter. You don't need a prescription. You can breastfeed because it has no hormones. The cons is that it may be noisy and it may be hard to put on. So this is a male condom. This is the female condom. This is the male condom, and this is anywhere between 85 and 98% effective. You use a new condom every time you have sex. This is available over the counter. You don't need a prescription. You can use it if you're breastfeeding. The cons of it is that it can decrease sensation, and it can cause loss of erection, and it can also break or slip off. So this is a male condom. This is the only method of all these birth control methods that prevents STDs, including HIV. This is a male condom. Then this is the NuvaRing. The NuvaRing doesn't have to be fitted. You don't need a prescription to get it, and it doesn't require any spermicide. This method, the cons of this method is that it may irritate your vagina, so you'll have more vaginal discharge, and then also it may cause spotting the first 1 to 2 months. So this is a vaginal ring. This is a patch. This is the Ortho Evra patch, and it's 92 to 99% effective. You apply a new patch each week, and you apply it either to your arms, to your back, to your abdomen, or to your buttocks. It can cause your periods to be more regular and less painful. It can irritate the skin, and you can have spotting the first 1 to 2 months when you first start the patch. This is a patch. Then we have the pills. This is an orthocycline, and this is a pill that you take one every day. It can improve your acne. You do need a prescription for this. You can have less PMS symptoms, like if you have menstrual cramps, it can decrease it, but it may cause some nausea, some weight gain, some headaches, a decrease in your sex drive, and you can have some spotting the first 1 to 2 months. So this is a pill. And this is the Depo. This is a shot that you only get one shot every 12 weeks, which would be about every 3 months. So you get it 4 times in the year. So the convenience is that you don't have to take a pill every day. The cons is that it may cause some weight gain, some skin and hair changes, some depression, and changes also in your sex drive. With this one, you may have some spotting initially, like the first two cycles, which would be about 6 months, or you might have no period at all. This is a Depo. Then we have the Imp, and this one is anywhere between 92 and 94% effective. And this is the implant, or Nexplanon. This is a Nexplanon, and it's more than 99% effective. It does have to be inserted by a provider. It has to be removed by a provider too. It can last up to 3 years. With this method, you might have some spotting, some bleeding, or no period at all. And that's normal for this method. Then we have the Mirena IUD, and this is 99% effective. This has to be inserted by a provider into your uterus. It may stay there between 5 to 7 years. With this one, it might you don't have periods, or you might have some periods for the first few months, but eventually you might not have periods. And this is the Mirena IUD. Then you have the Paragard IUD, or also known as the copper IUD. This is 99% effective. This has to be put in your uterus by a provider. It's good up to 10 to 12 years. So you don't have to worry about taking a pill every day. But the cons of this method is that you might have increased periods or heavier periods, and then you might also have some increased cramping, especially the first few months. So this is a Paragard IUD. Well, I hope this review helped you decide on the method. All these methods can be discussed at length with your provider in our clinic, and also it will also depend on your medical history. But just remember that the only method that is 100% effective with no side effects is abstinence. Thank you.